Anyway, let's look at another article from the SAC-B, from the local section here. And this is regarding patients, nurses worry about after tech failure. Let's see here. Criticisms raised through CEO praises response. And this is by Kathy Anderson. So, the company-wide information system failure at Sutter Health last week is raising concerns among some nurses and at least one patient about how the healthcare giant functioned amid the crisis. In a video message to Sutter Health employees, Sutter Chief Executive Officer Sarah Crevens complimented the patient's thoroughness, commitment, and passionate resilience of employees, saying all of this helped to ensure the continuity of high-quality, safe patient care. We will be reviewing every aspect of this event, taking seriously every recommendation for improvement, she said. I also want to hear from all of you. I want to know what happened where you work. Then it goes on to say she could use a hearing from some criticism. She could be hearing some criticism based on the comments of two nurses at Sutter Medical Center, who both spoke to the Sacramento Bee on condition of autonomy out of fear of reprisal by their employer. They expressed concerns that some patients were admitted to Tuesday after the system's failure, despite gaps in hospital resources and despite absence of critical patient information. For instance, a surgical nurse said the surgical team relies upon computer access to a history and physical done within the previous 30 days and certified by the physician as still being valid on the date of surgery. While patients were arriving with their histories and physicals on paper, the nurse said the documents didn't include the doctor's certification that the patient's condition hadn't changed. If something had wrong in the it went wrong in the elective surgery, the nurse said the medical team would have relied on those documents to access the cause. Other Sutter hospitals canceled elective surgeries, the nurse said. Why did Sutter Medical Center feel they needed to do elective surgeries? There was also at least one instance Tuesday, the nurse said, when a surgeon needed instruments not stored in the operating room. The operating room telephones normally display a directory of numbers to supply rooms and nurse stations, the surgical nurse said. But because that was inaccessible, nurse had to scramble from the room to get to the instruments the surgeon needed. The surgical team normally tries not to leave the operating room because of the patient's condition, and then the C2B. Hold on. So it says can deteriorate in seconds, the nurse said. In addition, the neonatal nurse told the Bee that Sutter's downtown facility was still accepting transports into the neonatal ICU, even though they don't have the resources to handle it while dealing with all computer systems down. In response, Sutter Medical Center Administrator Rick Harrell said because of the system failure, the center at some point on Tuesday suspended accepting new patients in all units until the staff could assess whether they had the capacity to safely